My name is Lee Song Tan. I'm an oncological surgeon. Today we're talking about how to prepare, how to preparation for preoperative patients, and also we talk something about how to prepare for post-operative patients. Actually, how to judge precisely, some patients with some cancer or with some very serious surgery. Actually, it's hard. It's almost impossible. And which kind of patient is risk or not. Because many obviously variables such as age, seriousness of the pulmonary disease, and some coexisting disease actually account for the intangible nature of the risk in any operation. So when asked to guarantee an operation, so even very experienced surgeon, is a very senior surgeon, also actually refuse to guarantee anything but his professional concern and competence. So actually estimates of such risk is at best actually is either educated guess based on experience. So how to assess for such risk here is there here actually three main elements. One for patients, another one the other one for disease, and another one for treatments. Here just mention a lot of factors, just like the age, heart, lungs, kidney, liver, blood, and the endocrine system, and dehydration status, and some nutrition status. So with some patients, first one for age, for some infants, prematurity, and extreme old age, actually, as we know, are associated with some increased operative risk. With operative of greater magnitude, so actually involved increased physiological stress. The mortality is substantially greater in old patients. Heart, of course, is very important for patients. So a man is as old as his arteries, especially his coronary artery and also for cerebral arteries. So with life-threatening disease arising in a patient with serious cardiac disease, even a few hours of intensive cardiac care to control hypertension, arrhythmias, or heart failure. This kind of condition can increase survival. Lung also is a very important organ for patients. Pulmonary dysfunction actually means inability to move air in or out of the lung, to clear the bronchial tree, or by coughing and to perfuse the lung, often underlie post-operative pulmonary complication. So sometimes heavy cigarettes smoking for some patients, this actually is a major cause. So we can ask how many flights of stairs some patients can climb, how many blocks some patients can walk without dyspnea. Can he comfortably carry out routine tasks? Also, if some normal exertion promotes shortness of the breath, So some patient, if with some situation like that, So we have to examine for pulmonary ventilation tests, also for arterial blood gases. Kidney, of course, is a very important organ for patients with surgery. Actually, chronic renal failure increases operative risk. Urine creatinine concentration should exceed by 10-fold the normal serum levels. Liver, of course, is a very important organ for patients. Jaundice and ascites usually indicate severe liver disease. Also, a negative history for jaundice and the normal serum bilirubin proteins and alkaline phosphatase, transmanases, and prothrombin time usually indicates an adequate liver. This is a child-POF system, how to assessment for liver function. Blood actually also, of course, is important. Here mentioned just anemia with fewer red cells to carry oxygen, lower oxygen delivery to tissue, and impairs the wound healing. Platelet counts below 50,000 per milliliter requires pre or intraoperative platelet transfusion or both. White blood cell is important, including macrophage. Sometimes it's defined against infection. Leukemia, Hodgkin's disease, diabetes requires actually also acquired immunodeficiency syndrome, just like AIDS, and immunosuppressive drug will impair these first-line defenses. General anesthesia agents and major operative interfere with the body's immune responses. Also, broad spectrum antibiotics must be used for this kind of patients. Preoperative treatments of the diabetes sometimes is very important. Some patients with diabetes, So one thing, for uncontrolled diabetes, distinct hazard must actually is a very distinct hazard. So for this kind of patient must be treated vigorously before induction of anesthesia. Glucose equal to more than or equal to 200 kilograms, and insulin must be given together in order for their body to utilize their carbohydrates. In general, hypoglycemia, sometimes coma, convulsion, is more hazardous than hyperglycemia. So for this kind of patient, you have to pay much more attention. Sometimes dehydration status is important to know, because various states of simple desiccation, extracellular fluid loss, hemorrhage, or loss of specific electrolytes can appropriately affect operative risk. Nutritional status also important to know, because some kind of chronic disease and subsequent malnutrition impaired wound healing. Parenteral hyperalimentation can provide proteins, amino acids, calories, include the glucose, vitamins, and minerals and fats. In short, total nutritional needs. Infusing these hypertonic solutions into high-flowed veins has made his life-saving procedure possible. Sometimes obesity is associated with renal disease pulmonary problems, also for diabetes, hypertension, cerebral vascular disease, and orthopedic problems. So obesity sometimes is important because this kind of condition can increase operative time. This can add to the risk of septic, pulmonary, and vascular complication. So for obese patients require brief operative procedures, intensive respiratory support, rapid mobilization, and sometimes have to use antibiotics and heparin. So another effect is the disease. The nature of the disease includes the malignant or benign, in fact, or sterile. Actually, this kind of condition, the physical disturbance it causes, the size and the length of time the disease has been present are all important factors that affect surgical risk. One thing we talk, for the malignant versus benign disease, for example, after gastric cancer, of course, it's high risk for operation. Of course, if you compare for gastric ulcer, so operation on specific organ by the large more hazardous for malignant disease than for benign disease. For thyroid cancer, it's similar. For the breast cancer, if you compare it with the benign and just like adenofibroma, of course, it's totally different. One thing for septic versus sterile disease, septic disease are more complicated with a higher mortality than sterile or relatively sterile disease. For example, for perforated appendicitis is a early acute. It's sometimes is a very early acute appendicitis. Of course, if compared very advanced, it's very serious for specific cholecystitis, uncomplicated. This kind for the specific disease, sometimes it's very seriously, it's very harmful for patients' operation. Also, the site of disease actually is in fact the operation risk. In descent order of operative risk, the site heart, thoracic, esophageal, brain, rectal, colon, stomach, and the lung. So of course everyone cause if some heart operation, it's of course very risk, very harmful. The nature and the extent of the disease is, of course, is a very important factor in each site. Of course, the disease, we mentioned another thing, for time elements. The longer the patient has had the disease, of course, the poorer the operative risk. So after patient is the condition is better, condition is pretty good. Of course, for the operative risk is pretty low. Otherwise, the operative risk is very high. The another thing for the treatment, treatment strongly influences both of the patient and the disease. This is the only one of the three elements, three factors of surgical risk over which the surgeon has much control. Knowledge of the patient's overall status and the disease is the key to successful management. So for the treatments, one thing for what's the magnitude of the operation for the operation. One thought should be clearly in mind. Surgical risk increase with the magnitude of the procedure. So the bigger for the operation, the higher for the risk for the patient. In choosing among the possible therapeutic options, the surgeon must weigh this critical factor of the surgical magnitude carefully. In addition, important factor is the skill of the surgeon and the team. If the patients to see a very skilled surgeon with a very nice group of the team, of course, it's very important, very helpful for some kind of patients. According to the time of the operation, we can divide the urgent operation. Most patient is for emergency, for example, for breathing people, for some organ, for population, for obstruction of the organ, and so on. Also, some time limited operation. For example, for some malignant tumors such as gastric cancer, breast cancer, and so on. Also, if the patient's condition is good enough, is sufficient enough, we can use the selective operation, just like for the gastric ulcer, benign tumor, hernia, and so on. Also, we can, according to the patient's tolerated condition for operation, we can divide good tolerated condition for operation, also for bad tolerated condition for operation. For example, a patient with is older than 80 years old, of course, for this kind of patient is a bad tolerated condition for operation. Even the surgery is very too big. Now let's talk about how to play operative preparation for psychiatric patients. Actually, psychiatric reports established during the pre-anesthetic visits will help to gain the patient's confidence and reduce the need for excessive sedation. So instruction and suggestion and psychiatric support are very important elements for preoperative operation for this kind of patients. The psychiatric preparation of a child and his or her parents is of utmost importance. Preoperative preparation for physical preparation. So for every patient, special training and education is important. Also, for some food and blood transfusion, sometimes also is needed. And for some patients, probably it's helpful for some infection prevention. Also for calories, protein, and vitamin, and some other nutrients is important for preparation for surgery. For gastrointestinal preparation, sometimes it's needed for some gastrointestinal surgery. Also, actually, some other things. Some specific organs and the system also important. Mentioned before, just like the malnutrition, cardiovascular system for some, so for example, for hypertension, for some heart disease, and so on. We have to prepare carefully. For some respiratory system, it's same. Also for liver disease, renal disease, diabetes, we have to prepare carefully. So for a patient, how to prepare his or her preoperative organ is important. One thing for that, for any patients should have nothing by mouth, including water in the oral medicine. Also, for medication, important. No medication should be given for relief of pain until a diagnosis has been established and a decision has been made whether or not to operate. Fluid therapy is important to correct dehydration and electrolytes imbalance. Also, for some case, for antibiotic is important. Also, for some selective operation, for proposed some procedure in the anesthesia is important. Also, we have got the consent for patients. Blood components should be cross-matched before operation. Also, take some shower and the preparation of the operative site. Nasogastric tube, Foley catheter, and IV fluids sometimes important. NPO after midnight is important. Or oral medication changed to parenteral administration, for example, IM or IV. Also something for pre-medication. Also for some case, animal also important. So if the patient goes through smoothly for some surgery, so how can we to management this kind of patient? So this which I mentioned, how to treatment the post-operative patients. Post-operative treatment is important. Here I mentioned experienced nurses in extensive care units is very important because this kind of nurse can reduce post-operative mortality more than any other factors. So this kind of nurse, their efficiency, skill, and dedication are more important than electronic monitor, suction, and inhalation equipment, or any of the other mechanical devices that aid in the post-operative care of patients. One thing for post-operative order, for what's the operation performed and the type of anesthesia, also how to let patient what's the patient activity, also what's the patient's vital signs for temperature, pulse, respiration, and blood pressure. Also a daily record of intake and output of the body weight is important. Care of tuber and drainage. Sometimes if the surgery is complicated, we have to put a few tubes there. So how can take care of them? It's important. Also for medication, for example, for pain control, it's important. Sometimes vomiting and abdominal distension sometimes is a very serious problem. So we have to give this kind of patients nasogastric intubation and suction. Also, we can use anti-emetic and other reagents to help patients. For also, for some surgery, post-operative is important. How to let patient cough, and also let patient hyperventilate is important. Of course, we have to examine some laboratory tests to monitor patients' blood or some chemical events in the body. Also, some wound healing and cure, for example, dressing change. So here I mentioned what's the incision type. Also what's the healing grade. It's important. Also suture takeouts. What's the time for suture takeout? Also, if the patient discharged from hospital, how to order for that, for discharge time, also discharge diagnosis, also for dates and time of the return visit, how to follow up is important. Of course, discharge medication include dosage and also amount. Also for some medicine, sometimes important. Here we mention something about the surgical complications. Complications may occur after almost any operation, regardless of its magnitude. Even simple routine diagnostic procedure may cause complication and even death. So, majority of all post-operative complications are signaled by one of two signs. For example, for fever or shock. So fever and shock sometimes just like cardiovascular collapse. So it's very important signal for how to help patients. So one thing for fever, actually is the most common for surgical complication. Fever is the most common evidence of the post-operative complication. Mild transient fever actually appears after almost operation from tissue necrosis or hematoma or cartilagization and so on.